Assalamu alaikum guys, this is Almas Khan and today I am going to discuss about hypercalcemia. So first of all, I would like to start from the definition of calcium. What is calcium? Calcium is a mineral that is necessary for life in addition to building bones and keeping them healthy. Calcium enables our blood to clot, our muscles to contract and our heart to beat. About 99% of the calcium present in human body's teeth and bones. Definition of hypercalcemia. Hypercalcemia is a condition in which the calcium level in our bloods is above normal. Too much calcium in our blood can weaken our bones, create kidney stones, and interfere with how your heart and brain work. Normal level of calcium in human bodies is 8.6 to 10.3 mg per deciliter. Now, what are the causes of hypercalcemia? First one is hyperparathyroidism, cancer, especially breast cancer, lungs cancer, and some blood cancers. Other diseases such as TB and sarcoidosis, heredity factor, immobility, severe dehydration, medication such as lithium, and supplementation such as taking excessive amounts of calcium or vitamin D. Now, what are the symptoms of hypercalcemia? Hypercalcemia affect kidney, so the symptoms are excessive thirst, excessive urination, kidney stones which causing pain, anxiety, it causes nausea, abdominal pain, decreased appetite, constipation, and vomiting. And muscles, it causes muscle twitching, cramps, weakness, and serious, it causes palpitation, fainting, and cardiac arrhythmia. In bones, it causes bone pain, osteoporosis, and bone fractures. In brain, it causes depression, memory loss, irritability, confusion, and coma. Now, what are the complications of hypercalcemia? The first one is osteoporosis, kidney stones, kidney failure, nervous system problems, and arrhythmia. Diagnosis: serum electrolytes, especially calcium level, urine analysis, parathyroid hormone level, chest x-rays for reveal lung cancer, mammogram for diagnosing breast cancer, CT scans, DEXA bone mineral density test. Now, what is the treatment of hypercalcemia? Calcitonin, this is an hormone which control calcium level in our blood. Calcimimetic, this type of drug can help control overactive parathyroid gland. Biphosphonate is a drug which can quickly lower calcium level. Denosumab, this drug is often used to treat patients with cancer caused hypercalcemia. Prednisolone, if your hypercalcemia is caused by high level of vitamin D, so short term use of steroid pills such as prednisolone are very useful. IV fluids, loop diuretics, and dialysis. Thank you for watching.